Okay. Okay, so again, my name's Anna. Just to give you guys a little background on where I've been at with my nursing career, I did start Corvallis, and I worked on kind of an IMCU / CVCU type floor. So my initial part of my nursing career was doing a lot of things related to the cardiovascular system. I currently am working in the anticoagulation clinic here at the hospital and also working in cardiac rehab. So the heart's kind of been my favorite thing so far in everything I've done nursing, and I've always found myself leaning towards that in all of the positions that I've chosen. So today we really are just wanting to talk about the cardiovascular system, probably similar to what you guys have been doing, going through all of the GI system as well, kind of giving you an overview of the anatomy and physiology of the heart, and then talking about the different diseases that you're likely going to be encountering on the floor at some point or another as CNAs here at the hospital, and talking about especially the signs and symptoms you want to be looking out for and what to do in those moments that you're noticing these signs and symptoms. Also, there's a lot of things as CNAs that you can be doing to help prevent some of these complications, and we'll be going into those too, okay? And this is super informal, so if you have questions anywhere along the way, please feel free. There's going to be a lot of times where I'm going to ask you to kind of answer, so just jump in. All right, so basic components of the cardiovascular system. So we've got our heart, the blood vessels. Those are the arteries, the veins, the capillaries, and then lymphatic system as well. So if everyone can just make a fist, put it just to the left of the center of your heart there. And that is center of your chest there, and that is going to be your heart. That's about the size of your fist, maybe slightly bigger than that. The whole purpose of the heart is to pump deoxygenated blood to the lungs to go get oxygen, and then to pump that oxygenated blood out to the rest of the body so that the rest of the cells and the tissues and the organs can get the oxygen that they need. So I want to talk about just the basics of the anatomy of the heart here, and let me know if I get in your way at all and you can't see. So we've got two top chambers of the heart. These are called the atrium, and then we've got the two bottom chambers, which are the ventricles. We've got the right side, and so this is my right side. So when I hold, that's going to be the right side of my heart here, and then the left side is going to be this side over here. All right, just want to talk about essentially how the blood flows through the heart. So the blue here is representing the deoxygenated blood, the blood that needs to get more oxygen so that it can go out and give that to the cells. So it's going to be coming in, these are coming in through the veins. You're going into your right atrium, down into your right ventricle, and then this chamber here is pumping that blood back out, and now it's going to go to the lungs where it's going to exchange the carbon dioxide and then get oxygen. Then it's going to be coming back through here now into your left atrium, flows down into your left ventricle, and then this is that main chamber that's going to be pumping the blood out. This is your aorta here, and then it's going to be heading out into the rest of your body. And again, the red here is kind of representing that now it's picked up the oxygen from the heart, from the lungs, and now it's going out to the rest of the body. Just note that both of the right atrium are going to be squeezing at the same time. Both of the left ventricle squeeze at the same time. As you can kind of see, the blood's coming in both and then going out both at the same time. Any questions on that at all? Okay. So we want to talk about the two phases of the heart contraction. There's this resting phase diastole. As you can imagine, before the blood can squeeze the blood out, it's got to have a second to be able to fill it back up with the blood. And so kind of looking over at that picture here, that right there where it's filling up, that's your diastole, that's your resting phase. The opposite of that is your systole, which is your contraction phase, the working phase. So over here, we see the atria contract, ventricles contract, and then it rests. So it goes atria, ventricle, rest, and it fills back up. Atria, ventricle, and then it rests. Okay, and then this is what happens when the blood actually heads out to the rest of the system. We've got our heart here. We're heading out through the aorta. We're going up through all of these main arteries. So these larger blood vessels that are red here are going to be your arteries. as you can kind of see here, like your abdominal aorta, that's going to be a big one. Sometimes you might see patients who have a complication with an aneurysm, which can be a very dangerous thing, where basically the blood gets into the walls of the aorta and is not doing what it's supposed to do, and it can be at risk for a rupture. If one of these main vessels ruptures, life-threatening, it's going to bleed out real fast, so you want to be on top of that. Those of you who are working on the cardiac floors, IMCU, I'm not sure if any of you said you were CVCU, but you're going to be seeing patients coming back from the cath lab a lot. And the way that they are accessing the vessels of the heart in the cath lab is going through the femoral artery. Those patients usually are getting their sheaths pulled out. They're going to be on bed rest for long periods of time. It's extremely important to keep that site safe, though, because as you can see how big that vessel is, I mean, that's super at risk for complications if that starts bleeding. So then we get into the arterioles. So these are going to be kind of the smaller branches that come off. And then they go to the capillaries, and we'll talk about that, where the exchange happens. Then on the way back, I don't have it on there, the venules are the smaller versions of the veins. And then we go up to the veins. And the veins are now carrying that deoxygenated blood, and they're going back up to the heart. Any questions on that? Okay. Okay. So just to, again, go through that, we go from our arteries to our arterioles, and it's branching off into these tiny little capillaries. And then once all of the exchange happens, and so in the capillaries, you're having the oxygen and the nutrients that are exchanging with the carbon dioxide and the waste. So the oxygen and nutrients are heading to the body cells, and in the reverse, the body cells are giving off the stuff that they don't want anymore. And so once that exchange happens, then back through the venules and through the vein and back up to the heart to repeat the cycle again. Okay, so now we're going to start talking a little bit about some of the diseases, but to start, before going into that, we want to talk about the coronary arteries themselves. So the heart, being a big muscle itself, it needs a lot of oxygen as well. The coronary arteries are what supply the heart with the oxygen that it needs to do the pumping. Just to go through some of these, so we've got our aorta here branching off the aorta. This is the left main. That splits off into your left anterior descending and your circumflex artery. And then over on this side here is your right coronary artery. As you can kind of see here, between all of those, they're really supplying all areas of the heart with the oxygen that it needs. This is an important one here. If you can imagine if this gets blocked, can you guys kind of remember what chamber of the heart sits right there? So it's going to be on the left side, right? And it's the bottom, yes. And where does the left ventricle pump off to? Everywhere, exactly. So if this part of the body, or if this part of the heart is not getting the oxygen it needs, and it's not working, you can imagine that now the rest of the body is probably not getting the blood that it needs because this area is not working right. Another big one I wanted to talk about is your left main here. As you can see, if this one occludes off, such a large portion of the heart would lose oxygen. Have you guys ever heard of the term widowmaker? Okay, it's in relation to a heart attack, but it's a type of a heart attack where this area gets blocked off. And they call it widowmaker, which is an awful term for it, but basically saying that a lot of people might lose their life if that artery gets blocked off because of how much of the heart that it supplies. All right. Okay, so our first disease, coronary artery disease. So these are our beautiful coronary arteries. That's, in a perfect world, blood flows perfectly. There's nothing hanging out on the walls of the arteries. This is showing atherosclerosis. So it is a build-up, generally, of lipids, cholesterol, fatty tissues on the walls of the artery, and it can narrow and it can harden over time. So blood flow is starting to get restricted at that point. But, a person might not even notice that that's happening because enough blood flow is getting through. One of the biggest concerns, if this is called a plaque over there, if that plaque ruptures, the body thinks, oh no, we've got an injury, let's send in all of our clotting cells. And so they're gonna come and they're gonna create a clot. And see if you can see this picture here, we've got no blood flow going through that coronary artery, and that would be a heart attack. But somebody who's, let's say, just in this middle phase, they have coronary artery disease. Again, they might not know about it, and it can be chronic. So people can be just living with this, know that it's something that they have, and may or may not be needing special medications or lifestyle modifications to kind of help with that. Okay, so I found that the only way I can get this to work is through this. Let me try. What'd you say? Thank you.
Angina is a symptom of a serious condition called coronary heart disease, also known as coronary artery disease. The heart's job is to pump oxygen-rich blood throughout your body. To do its job, the heart needs a steady supply of blood. The vessels that supply blood to your heart are called coronary arteries. These very important vessels are located on your heart. In a healthy heart, blood flows freely through the coronary arteries, providing the heart with the oxygen it needs to work properly. In coronary heart disease, the vessels become stiff and narrow, making it difficult for oxygen-rich blood to reach your heart. Reduced blood flow that occurs following exercise or emotional stress leads to chest pain or discomfort known as chronic stable angina, which is relieved by rest or nitroglycerin. If a clot develops in the coronary artery, blood flow is reduced more severely. This leads to chest pain known as unstable angina, which usually occurs at rest, and it requires immediate medical attention. In summary, when blood flow is reduced, your heart does not get as much oxygen as it needs, so it cannot pump blood like it should. This lack of oxygen is what causes the pain and discomfort of angina. If you have coronary heart disease, angina is your heart's way of telling you that it needs more oxygen. Talk with your cardiologist if you have questions about angina.
Okay, so angina is really just the term for the symptom of having chest pain or chest discomfort related to, oh, sorry guys, I have to scroll through here real quick. Okay, so it's the actual symptom. So it's that feeling of chest discomfort, chest pain that's related to the heart not getting the oxygen that it needs. Yes.
Is it more commonly found in older patients or like geriatric patients?
Yes. So coronary artery disease, the risk for that is going to greatly increase the older that you get. So yes. Yeah. So it's a feeling of chest pain or discomfort caused by an area of the heart that isn't receiving enough oxygen-rich blood. I really like in that video that it says, like, angina is your heart's way of telling you that it needs more oxygen. It's not getting enough oxygen. Just to really briefly go through this isn't super important for you guys to know in your everyday CNA work, but there's stable and then there's unstable angina, and the video briefly talked about it. Stable is going to be those patients who we know that they're going to have some chest pain. They know that they're going to have some chest pain when they do something that puts stress on the heart. So they're going to exercise and they know that chest pain might happen with that. Walking up a flight of stairs, stress, cold weather, all of that stuff could make it so that the heart's under a little bit more stress, and so those symptoms become obvious now. They start having that angina. Usually has a pattern, usually goes away with rest or medication in a short period of time, 1 to 15 minutes or so. Unstable though, this is the one where it's a concerning thing, and patients definitely need to go get checked out if they're having. And so that's when they're having chest pain at rest. It's not really, there's no pattern to it. It's not like, oh, I go for a walk and I get chest pain. It's I'm sitting here doing nothing and I have chest pain. It can be worsening. Rest, medication, they don't really seem to have the effect on it, and it's usually going to be for a longer period of time, more than 15 minutes. So then, of course, this is what happens when a coronary artery gets so blocked off that an area of the heart is not getting the oxygen that it needs. The damage is happening. There's actually death happening to that heart tissue. So if and when a patient is having a heart attack, time is an important factor to get to where they need to go to get those vessels opened up to get that part of the heart blood flow again. You can see this lady, she's got this crushing chest pain. And we're gonna go through here some of the other signs and symptoms you might notice with it, because it's not always just gonna be presenting as this perfect, crushing chest pain like this lady is feeling. Okay, what do you guys think? Can you think of any other signs or symptoms that might be happening with a heart attack?
Shortness of breath.
Yes. Weakness? Mm-hmm. Yes. Mm-hmm. Can you think of any other areas of the body sometimes that pain might go to? Anybody?
Left side.
Sure, left side, yep. Or sometimes it can be both sides. Either of the arms can hurt. Oh yeah, go ahead.
Can they get tired?
Yeah, but they can definitely feel fatigued. Mm-hmm. Yep, it goes up the neck, up to the jaw. Sometimes you'll see patients that have jaw pain. Sometimes it can go to the back. They'll complain of back pain. So those are definitely part of it. Fatigue, weakness, that's a big part of it. Sometimes patients, and women often present differently than the typical, crushing chest pain, et cetera, et cetera. And sometimes fatigue, that's their only real symptom. Sometimes you might have some, I'm gonna go ahead and go to the slide and we'll talk through them. You guys did great. So they can have sweating. They can be very diaphoretic. They can be sweating a lot. Shortness of breath, abdominal pain, pale or clammy skin because they're just not getting the oxygen to the rest of the body, unusual fatigue, dizziness or lightheadedness, all those different pains. They can be having heart palpitations because their heart is starting to beat differently because it's not getting the oxygen it needs. Nausea or vomiting is another one that can definitely go with it. Inability to sleep, I mean, that's going to be kind of common for so many different things, but it's on there too. Okay, so what do you do? I'll tell you guys a quick story. The one and only time I've seen someone actively having a heart attack, it was very scary. It was one of my patients who was actually scheduled for open heart surgery that morning. They were going to be the second case, which usually was like at 10 o'clock or something. So we were still in the midst of getting them prepped. He had just gone to the bathroom, came back. I had a CNA actually come and say, your patient's having chest pain. Go in there. And this was a relatively healthy looking male, probably in his 50s. And he had gone from looking great to it was very scary, extremely pale. He was so anxious. You could tell like he did not feel like anything was right. Very sweaty, clammy, all of those things. And he became first case that day and everything turned out fine. So that was a good story. It turned out well. But let's say you guys walk into a room and that's the patient that you see. So I kind of helped you out there a little bit. What's the first thing you want to do? Yay! Okay, perfect. Report it. Okay, so you guys on the floors will likely have phones on you. So I would stay with that patient. Actually, I'm kind of helping out and giving you some of the next ones. So I would not leave that patient though. So I would call the nurse or just peek your head out that hall and yell for some help. But what might be one of the things that happens with this patient who's having a heart attack?
They could be falling, so you want to use them down.
Absolutely, yep. Get them to a safe place. Mm-hmm. Or they might end up going into a heart rhythm that requires us to call a code and start CPR, right? So we want to make sure that we're at the bedside, keeping a close eye on this patient. What other things do you think you could be doing to help, especially when the nurse gets in that room, to help give them a little more information? Perfect. Yep, grab a set of vital signs. Okay, and promote rest. So like you said, if they're moving around, get them to a place where they are not moving around. Okay, so that was pretty much coronary artery disease and heart attack. Do you guys have any questions on that? Because we're moving on. No? So far so good? Okay. All right, so heart failure. So the definition is that the heart is not able to pump enough blood to the body's other organs. So this is usually a progressive heart disease. So it involves damaged muscles of the heart not being able to pump blood effectively that kind of slowly happens over time. It's a common cause for hospital admissions in adults over 65 years of age. So a lot of probably what you'll be seeing on the floors. Common cause for readmissions too, and we'll talk about it, but there's a lot of things, a lot of patient education and a lot of lifestyle changes that they need to make as well to be able to prevent the symptoms of heart failure from getting to the point where they need hospitalization. So we'll talk about some of that stuff because you guys will be able to assist the nurses with at least maintaining some of these things while they're in the hospital. So causes of heart failure. So a heart attack, which is what we just talked about. So if they ended up having that heart attack and the LAD that we talked about and the left ventricle that region ended up getting some damage to the tissue or some death to that tissue. Well, maybe that squeeze is just not going to be the same the way that it used to be. So that's one of the causes of heart failure. High blood pressure.